Hi, it's Dr. Bells from Integrated Health Solutions, and today's blog is about neck pain, its causes, and treatments, especially the ones available here at Integrated Health Solutions. So first we're going to go over possible causes. Neck pain can be caused by many things, chief among them chronic poor postures, trauma, and bad movement patterns that can cause overuse and strain on several of the muscles in the same area. It can also be affected by lifestyle habits like sleeping postures, ergonomics at work that's quite poor, as well as just an abundance of stress sometimes can negatively affect that as well. The next thing we'll be going over are treatment options that we have at IHS to help with that. So the first one will probably be chiropractic care or adjustments. Adjustments add mobility to the joints, so they're very good at restoring that mobility which you need to have like full function of the neck or the upper back. We also do manual therapy, so that would be soft tissue work. It could be scraping or by hand. It's often done in areas that we cannot dry needle, but it's very good at increasing the flexibility and releasing adhesions and tension in that muscle group, so you can get back to full range of motion and also move the way that you're meant to move. The dry needling is very helpful specifically for trigger points. So we use dry needling with TENS usually, and it can be done in areas with overactive muscle trigger points and underactive muscle trigger points. It helps in either case and really helps so that when we give the functional exercises, which is the next step, you can activate the muscles that you need correctly and use them the way that they're meant to be used so that you're more successful in your rehab here. In the blog, we'll also go over neck stretches and exercises, specific ones for specific muscles that might be affecting you or where you might be having pain. That can help alleviate some of that, and they'll be named, and we'll go over those in the blog. Finally, we'll go over pillow choices, which is a very common question I get by people with headaches and neck pain. I wish that there was one perfect pillow that worked for everyone, but that is just not the case. So for most of us, it's going to be dependent on what position we sleep in, how firm the mattress that we already have is, and the distance here between the shoulder and the neck, especially if you're a side sleeper. Side and back sleeping is recommended. Stomach sleeping is not recommended at all, especially if you have neck pain. So I hope these tips and information is really helpful to you. If you have any questions, please reach out. We are very passionate about helping people get out of pain and get back to doing what they love.